And as we come into the next slide, I'd like to welcome everybody into the session today. This is episode 3 and bring you some important information on COVID, some of the testing, some of the practices, and as Dr. Russheim talked about earlier, there's into the infection control update as we come in. Again, this is just a reminder, this is a series of joint effort with the Virginia Department of Social Services Divisions of Licensing and Programs and the Virginia Department of Health testing team and the Virginia Department of Health COVID-19 team. So these episodes will continue through June 2021 in each installment of the series to help us gain insight from our guest speakers, the subject matter experts on the topics related to the pandemic. Today, the overall goal is to provide the adult living, the ALFs with the information needed to keep the residents, residents and staff safe and safe during these unprecedented times. Let's take a minute and take a look at the agenda. Here we're in the beginning of the welcome part, so we'll kind of keep mindful of the time. It's just, again, I'd like to take a brief welcome to welcome Debra Hopkins. Debra's part of the VDHS Office of Licensure and Certification, or OLC, and a member of the VDH Healthcare-Associated Infections team, or HAI team. Debra will discuss COVID at-home testing and CLIA best practices. We have after Debra's presentation, we'll have a brief Q&A session about her presentation. And then just to remember, if you want to address those questions, put them into the all panelist questions that you see, all panelists and all attendees that come in. After that, Dr. Rehab Abdelfattah will come in and Lisa Sollot will come in. Lisa Sollot, sorry. They are also members of the VDH HAI team, and they provide COVID-19 infection control update. So after Debra's presentation, again, we'll follow up with a question and opportunity for questions and answers at the end. And we'll take a few minutes, and we may have an instant poll set up at the end just to kind of get your opinion, a hard one question that we come through to see how we're doing. All right, we're going to hopefully get Debra an opportunity. I'm going to stop sharing my screen and hopefully get Debra to get an opportunity. We were practicing this earlier and it didn't do as advertised, where Debra can come in. So, all right, Debra, I'm going to turn it over to you. Thank you.
Well, thank you. I appreciate everybody joining us today and giving me the opportunity to talk a little bit about CLIA. If you haven't heard of us before, CLIA stands for the Clinical Laboratory Improvement Amendment. And it's a federal regulatory program that CMS enforces and we administer here at the Virginia Department of Health's Office of Licensure and Certification. Often we get asked, do I need a CLIA certificate? So any facility that examines human specimens for diagnosis or treatment of disease is considered a laboratory and therefore must meet the CLIA regulatory requirements. If you are considered a laboratory, then you would need a CLIA certificate. There are different types of CLIA certificates, and the type that you would need depends on the type of testing that you perform. So we're very blessed that the COVID tests have been classified by the FDA for home use. So I think there's 4 or 5. And this enables folks to order a COVID test, have it delivered to their home, self-collect the samples, and then test in their own private residence. These same tests, when they're used in a patient care setting, are classified as CLIA waived, and they would require a certificate of waiver. Let's see. Oh, yeah. So the next slide shows a CLIA certificate is a type of certificate. So it's like a piece of paper. Facilities that have a CLIA certificate waiver can perform any test that's classified as waived by the FDA or has an FDA emergency use authorization for a waived testing environment. So you may see a lot of fingerstick glucose testing that is waived. And so a lot of folks have a certificate of waiver for that. Some PT-INR testing. The test categorization really depends on the complexity of the test being performed, not the test itself. So A lot of times we get a call, do I already have a CLIA certificate? You know, I'm new in my position. So there is an online CLIA lab lookup at the CMS website, and I've included that here on this slide. And then the follow-up question is, how do I get a CLIA certificate? It's pretty simple these days. You just go to your search engine and type in CMS 116, and it should take you to this CMS CLIA website, which will allow you to download the CLIA certificate, which is called, application, which is called an application for certification. And here's the first couple pages. I've highlighted in yellow the mandatory fields. We can't enter the data into the system without these fields that are highlighted. Optional is the email. So it's very important that you put an email. So if we have any questions and say, hey, you forgot, line 3, then you can just email us the answer and we can attach it to your application. We also can send you that CLIA number that results after you have had your application processed. Here on page 3, you would write down what type of wave testing you would be doing. You also need to include the estimated total annual volume. So you just guess, I'm going to be testing, 2 people a day, 365 days a year, multiply that out. It's just for information gathering, but it is a required field. Page 4 is blank, so I did not include that on our example. And here on page 5, you want to make sure that you get your director to sign the bottom of this page. Now, the director for a certificate of waiver does not have any required credentials. So it's whoever you decide you want that director to be, to make sure that you adhere to the regulations. You're going to take that application and mail it to our office. Overnight mail is being recommended at this time. We're having some mailing difficulties. Don't send us any money. We don't do that in our office. Once we email you your CLIA number, if you want to pay online, you can do that at pay.gov, or you can wait to get your bill, and that will come via mail, and that's called a fee coupon. So for wave COVID testing, there are a few things that you want to do. You want to make sure you follow the manufacturer's instructions, their recommendations. Read that package insert very closely. Some of these folks have great online training that you can have your staff participate in. So you want to make sure you document that training. These kits have to be stored at a certain temperature, and that's really important when it gets really hot in the summer and really cold in the winter. Most of them, are stored at room temperature, but if you have some heating and air conditioning problems, you may be outside of the range, and that can give you some false results. You want to also make sure that you report your test results to VDH or HHS. This is really a quick presentation, but I wanted to just go over the highlights and some of the questions that we do get in our office quite often. You can email inquiries to our generic email address. We have several people that monitor this, and we'll get you a response the same day, and that's clialab@vdh.virginia.gov. So that is the end of my portion. If there's any questions, I'd be glad to take those. Let me stop sharing so I can get back to the chat. All right.
We get us a quiet group today. Any questions? Got a couple minutes. Everyone might be typing in. Give it a second or two while they type it in. Again, the slides will be provided on the website after the presentation. We'll load everything up, as will be the recording. So. And
Dr. Rossham pointed out that there are 9 COVID tests that can be performed at home. Some do require prescription, some don't, and that the CLIA certificate for home testing is not required if it is in a personal residence, private residence. If it is in a healthcare setting, it is required. That definition of healthcare setting for assisted living sometimes can be a little tricky. So please give us a call if you're not sure, or email us, and we'll be glad to talk that out.
Everybody's thinking of the weekend already. Yeah, where that's all that's going there. They got all in their head, the long weekend. So thank you. And next up, I'm going to turn over to control with hopefully welcome to the world of Zoom to Lisa Sollot so she can provide her presentation. And she's with the VDH Healthcare-Associated Infection teams, as I mentioned earlier. And she's here with Dr. Rehab Abdelfattah, who had that discussion. So, all right, Lisa, you should be able to present your slides and we'll send unmute and be able to go. So we saw Zoom doing funny things earlier.
Awesome. Thank you, Dr. Ross. Yep, let me see if I can share my screen here. Okay, I think we should be in business.
And we are there.
Awesome. All right, let me just get this going. Okay. There we go. Okay, good afternoon, everyone. As Dr. Rossheim mentioned, I'm Lisa Sollot. I'm one of the Regional Infection Prevention Program Coordinators with the HAI team at the Virginia Department of Health. I'm here today with my colleague, Dr. Rehab Abdelfattah, who's going to be around at the conclusion of the presentation to assist with any questions that you guys might have. So I'm going to go ahead and jump on into it. So the interim public health recommendations for fully vaccinated people was posted on May 13th and can be found linked here. It says that fully vaccinated people no longer need to wear a mask or physically distance in any setting. However, this does not apply to healthcare settings. Staff, patients, residents, and visitors should continue to wear masks as recommended in all healthcare facilities. Healthcare settings refers to places where healthcare is delivered and includes, but is not limited to, acute care facilities like hospitals, long-term care, acute care facilities, inpatient rehab facilities, nursing homes and assisted living facilities, of course, home health care, and then a couple other smaller outpatient services listed here. This is not an exhaustive list. If you have any questions regarding this list, please feel free to reach out to us. We're happy to help walk you through with it. Healthcare facilities should continue to refer to the updated healthcare infection prevention and control recommendations in response to COVID-19 vaccination for recommendations regarding source control and physical distancing in healthcare settings. Highlights from CDC's healthcare infection prevention and control recommendations in response to COVID-19 vaccination was updated on April 27th. It included updated recommendations for communal activities and dining. It said that fully vaccinated patients and residents can participate in communal dining without the use of source control or physical distancing. However, if unvaccinated patients or residents are dining in a communal area, such as a dining room, all patients and residents should use source control when not eating, and unvaccinated patients and residents should continue to remain at least 6 feet from others. If vaccination status cannot be determined, the safest practice for everyone is to follow all recommended IPC practices, including maintaining social distancing and wearing source control. In general, fully vaccinated healthcare personnel should continue to wear source control at work. However, fully vaccinated healthcare personnel can dine and socialize together in break rooms and conduct in-person meetings without the use of source control or physical distancing. Oops, I think that my screen may have frozen. I'm having a little technical difficulty here. Okay, I think we're good now. Okay, and I apologize where I left off here. If unvaccinated healthcare personnel are present, everyone should wear source control, and unvaccinated healthcare personnel should physically distance from others. So that's pretty similar to the one here. And just to clarify, source control in this situation means a mask. So it would be a mask appropriate for the situation. If you're in a patient care room, for anyone that is requiring an N95, an N95 would be the mask, and outside of that, a healthcare mask. Moving on. I apologize, I'm having a little trouble with my slides here. There we go. Work restriction for asymptomatic healthcare personnel and quarantine for asymptomatic patients and residents. Fully vaccinated healthcare personnel with higher risk exposures who are asymptomatic do not need to be restricted from work for 14 days following their exposure. However, healthcare personnel who have traveled should continue to follow those CDC travel recommendations and requirements. Fully vaccinated inpatients and residents in healthcare settings should continue to quarantine following prolonged close contact, defined as within 6 feet or for a cumulative total of 15 minutes or more over a 24-hour period, with someone with SARS-CoV-2 infection. Outpatients should be cared for using recommended transmission-based precautions. Quarantine is no longer recommended for residents who are being admitted to a post-acute care facility if they are fully vaccinated and have not had prolonged close contact with someone with SARS-CoV-2 infection in the prior 14 days. SARS-CoV-2 testing. Anyone with symptoms of COVID-19, regardless of vaccination status, should receive a viral test immediately. Asymptomatic healthcare personnel with a higher risk exposure and patients or residents with prolonged close contact with someone's SARS-CoV-2 infection, regardless of vaccination status, should have a series of 2 viral tests for SARS-CoV-2 infections. In these situations, the testing is recommended that the first test be done immediately and that the second test be done 5 to 7 days after their exposure. For more information on a higher risk exposure, you can visit the CDC recommendations. You can also contact your local health department or reach out to the HAI team as well. People with SARS-CoV-2 infection in the last 90 days do not need to be tested if they remain asymptomatic, including those with a known contact. In healthcare facilities with an outbreak of SARS-CoV-2, recommendations for viral testing for healthcare personnel, residents, and patients, regardless of vaccination status, remain unchanged. So what triggers testing in long-term care facilities? The first is a symptomatic individual is identified. In this case, test staff and residents, both vaccinated and unvaccinated, who have signs and symptoms. Number 2, in an outbreak scenario, test all staff and residents, vaccinated and unvaccinated, that previously tested negative until no new cases are identified. Number 3, routine testing of asymptomatic healthcare personnel for healthcare facilities that are performing screening testing. Unvaccinated healthcare personnel should continue this expanded screening testing. For asymptomatic healthcare personnel who do not have a known exposure, vaccinated healthcare personnel can be excluded from this testing. This is just a summary table of quarantine recommendations for those in healthcare settings. Healthcare personnel are currently required to quarantine if they are unvaccinated and have traveled either domestically or internationally. For patients and residents, fully vaccinated residents and inpatients in healthcare settings should continue to quarantine following an exposure to someone with COVID-19. Unvaccinated residents, either newly admitted or readmitted to a post-acute care facility, or for unvaccinated residents who are leaving the facility for greater than 24 hours. Quarantine is currently not recommended for residents, regardless of vaccination status, who are leaving the facility for fewer than 24 hours and are asymptomatic and have not had close contact with someone with SARS-CoV-2. However, facilities might consider quarantining residents based on an assessment of risk, since uncertainty exists about adherence or adherence of those around them to recommended IPC practices. This is also a good time as a reminder to educate patients leaving the facility to avoid crowds, to wear a mask, especially if they're unvaccinated, and to report to you if they have any issues while they're out, run into crowds, have issues with their mask, or do come into contact with anyone who's experiencing any symptoms. Okay, so we're going to run through a couple scenarios. So this is visitation scenario number 1. The scenario is residents who were infected with COVID-19 or residents who live in quarantine. Indoor visitation is limited to compassionate care for vaccinated and unvaccinated residents. Under scenario 2, the COVID-19 county positivity rate is greater than 10% and less than 70% or equal to 70% of residents are fully vaccinated. Indoor visitation for unvaccinated residents should be limited solely for compassionate care, but can be used for vaccinated residents. In scenario 3, an outbreak occurs, defined as a single new case of COVID-19 in a healthcare personnel or a new facility onset case in a resident. The facility should immediately begin outbreak testing and suspend all visitation. If the first round of outbreak testing reveals no additional COVID-19 cases in any other areas of the facility, then visitation can be resumed in the areas that didn't identify any COVID-19 cases. However, the facility should still suspend visitation on the affected unit where the COVID-19 cases were identified until the facility meets the criteria to discontinue outbreak testing, which is 14 days with no new cases. If new cases are identified on the first round of testing in other areas with indoor visitation, then indoor visitation should be suspended for all residents until the facility meets that criteria to discontinue outbreak testing, defined above as 14 days with no new cases. Scenario number 4, what do we do when a resident is sharing a room? Visitors for residents who share a room should ideally not be conducted inside of the resident's room. If in-room visitation must occur, an unvaccinated roommate should not be present during the visit. Residents and visitors should physically distance from others and healthcare personnel inside the facility. And then just a reminder that outdoor visitation is still preferred even when the resident and visitor are fully vaccinated. Outdoor visits generally pose a lower risk of transmission due to increased space and airflow, and then of course offer increased opportunities for physical distancing. That was my last example. Myself and Dr. Abdelfattah are with me to answer any questions that anyone might have.
Bill, okay, we couldn't hear you if you were speaking.
Yeah, I was doing the same Zoom. My microphone was bouncing off and on as I was watching my little go. So we did have a question about the PowerPoint slides. They will be loaded on the site, and see if we have any questions for our panels today. See if I know we covered quite a bit and threw a lot at you in a short period of time. So I want to open up for a couple minutes for questions or comments as we move forward. Then I'll have a short poll. I'm going to ask for some input, just give us some feedback on how well we're doing. Watching the chat. Quiet group today.
Yeah. Also, if we've got a lot of time left, so if there are other questions that you want to ask, please feel free to do so.
Hi, good afternoon. This is Rehab. Can you hear me okay?
Yes.
Great. Yeah, thank you for having us today. And because there have been a lot of updates to the CDC guidance, so we try to present this in a different way. We try to put them in tables, scenarios, just to help with the implementation of these recommendations. We are getting some questions, and sometimes it's difficult to understand or keep up with these updates. So I hope you find that helpful, and I really appreciate the time. I see one question right now in the chat, and it's regarding the vaccination status for residents and staff. And I really appreciate that question, because when you open the CDC recommendations, I believe the one that was posted sometime in April, you know, the patient and staff confidentiality is very important. So while we are saying that there is some relaxation of these restrictions for those who are fully vaccinated, and you will feel that there will be a problem keeping the confidentiality. However, you know, there is a room for being creative, and the CDC had an example. If you are, for example, arranging for a group activity, and you can, just to keep the confidentiality, you can have some form of a sign sheet or something that a resident can sign in, and then you can select those who are fully vaccinated without, you know, letting everyone know that those who didn't get the vaccine for any reason are not joining this group because they are not fully vaccinated. Definitely, we need to do our best to keep this information confidential and be sensitive to some, because some people can't get the vaccine because of a medical condition, for example, maybe they are a little bit hesitant, and we don't need to uncover that. So just be sensitive and try your best, be creative to keep the confidentiality for both your residents and staff, and encourage your staff to get vaccinated if they can.
Thank you. We do have a couple more questions I'll put out to the panel, and everybody can see them. If you have a facility that's all resident staff and family members are vaccinated, when do you think that we can stop wearing the mask? Has that been determined yet?
That's actually a good question. I believe we will, we will follow what the CDC recommend, and I can see that the community transmission is actually going down in most of the districts here in Virginia, with some exceptions, and which is great. I'm not saying that we are going to do that anytime soon. Maybe this is something that will stick with us for quite some time, but I'm expecting that when we reach a good herd immunity and minimum or zero community transmission, that might be an option, but it's just my personal expectation, and it's not something that has been posted right now.
Oh, thank you. And I think Dr. Rosheim covered that. We had another chat concern about supplies with a point of contact, so hopefully you're able to answer that. So.
Yes, I put something, I put the email in the chat. So if people have questions about testing or testing supplies, they can either email me, or they can, or reach out to me, or they can email antigeninfo@vdh.virginia.gov.
I see one more question regarding if everyone is vaccinated, visits for roommates in room are allowed. Having, it's usually better, as Lisa mentioned, to arrange for these visits outdoors if possible, if the weather is good and suitable for that, because of the ventilation. However, if the patient, like you mentioned, on hospice, it's better to have only one, one resident at a time during the visitation. If that's not possible, and the least preferred is having both the patient and the roommate in the room during the visitation, just try to educate and enforce the face mask and the social distancing, even if everyone is vaccinated, just because, patients in hospice that might have some problems with their immune response to the vaccine. So it's better to be more careful and advise them, educate them on maintaining the social distancing of 6 feet and keep on their face mask as well.
All right, we had another question that came in. I have one, and I think I have Hathcock. I'm not sure. You had a question in there. I got Hathcock as listed as a name, and I'm not sure if you want to. I'm going to unmute you and see if you raise your hand for a question, give an opportunity to chat while we look at the other question at the bottom. Oh wait, I think you're all right. You're putting it in the panel. So all our residents we have 2 questions. The one is from Lauren Friedman. When testing associates are we using the testing kits that have been sent to the community, the rapid ones, or do we need to use the lab service, not the rapid?
This is Brooke Rosheim. This is really up to the facility. You can, if you're receiving supplies from VDH or HHS, so if you're receiving Binax Now cards already, you can use those. That's fine. You can also use if you want to send specimens out to a private lab. So if you want to do, nasal swabbing and send those swabs for PCR testing out to a private lab, that's fine as well. So really it's up to the facility as to what you would like to do.
All right, thank you. And we have another one from Hathcock. All of our residents are in private rooms. The resident is vaccinated and the family member is vaccinated. Do we still have to wear face masks?
As Lisa mentioned, that currently the CDC recommends all staff, patients, residents, and visitors to continue to wear face masks as recommended in all healthcare settings. So I believe everyone still have to wear the face mask. However, if the staff or the visitor and the patient or the resident are fully vaccinated and both are inside a private room, the resident might select or choose to get closer to the visitor and like have a hug or something. So it's in terms of physical distancing, they can, if they want not to keep the physical distancing during that meeting, they can do that. However, still, regardless of their vaccination, they still need to have their face mask on.
Thank you. And then see if Corey has your question. Is there any concern with the relaxed guidance, and it kind of builds on to that relaxed guidance with the mask wearing between employees who are eating and the need to pull them from the workforce if any of them becomes a PUI?
I'm sorry, I'm trying to, is there any concern with the relaxed guidance of mask wearing between? Can you please explain that more? Because I'm
gonna try to find Corey. I'm gonna try to get you to unmute if you don't mind, and if I can get my it's a slow process today with you should be able to add in, and if you can unmute Corey and then maybe expand a little bit on your comment, we'd appreciate that.
Sure. Hi, everyone. Thank you so much for the presentation. We are having some concerns with this guidance about employees that are fully vaccinated that are eating together, and one now is becoming or has become a PUI, and now we're removing them from the workforce because they are symptomatic, and taking out all those folks. So I wondered if there was any thought about, changing that guidance, and what the I know the current regulations or the current guidance is allowing this if folks are vaccinated. And I just didn't know what the panelists were, their thoughts were on that.
So just to make sure I understand the question correct, so the CDC gives a permission for staff who are fully vaccinated to get together while dining, and they can take off their mask. You mentioned that one of them, after that, one of these healthcare professionals become infected or has symptoms?
Yes, so currently in our organization, we have very strict guidance. And if someone has any symptoms, they're considered a PUI. And then from that, we do the contact trace, and then we pull all of those who were in close proximity to that person. And so we are just revisiting our mask guidance for even fully vaccinated employees who are eating together. So I just wondered if that was a concern that anyone else was experiencing, because our workforce is rapidly depleting as with this problem.
Yes, that's definitely a concern, and I'm not aware. It's up to other providers as well to comment on that. I'm not aware of a similar situation. Definitely, that's concerning, and we still getting. Maybe I will back up a little bit, and we maybe early this week we received a question regarding do we still need to screen, and it was from a long-term care facility. Do we still need to screen staff? Or we can just, let them fill in a form or complete an electronic form before immediately coming to work if they have symptoms or a high-risk exposure. That definitely, CDC still recommends to screen staff before or anyone, visitor, anyone coming into the facility for symptoms and exposure. So sometimes everything, there is no symptoms and there is no history of high risk exposure. So it depends on the transmission in the local community. So I believe it's not one size fits all. If the facility sees there is an overwhelming or there is a high transmission in the community, or just an example, if this staff may be working another job or they might have a high risk exposure, that might also guide the how you recommend or handle their gathering in a dining room or in a break room. So if there is some doubts about that during some sort of a risk assessment, if there is some doubt about their those who are around them, their compliance with the recommended infection prevention and control recommendations or the practices, you might need to still keep the physical distancing between them in the dining room. I'm just, trying to introduce the idea of a facility can definitely decide what practices they will adopt, and they can go even higher in their restriction if there is, based on the risk assessment, if there is a risk of a transmission. But I would love to hear from other providers if they have a similar scenario or any input from their side. I hope that helps a little bit.
Yes, thank you very much.
Thank you, Corey. And then we have one that's probably not ready to provide here. You have any fully vaccinated seniors in Virginia's long-term centers settings contracted COVID? We have any figures that we're prepared to discuss?
I need to check with our data team. I know that we have some sort of supplemental form if we get notified of an outbreak in a long-term care facility, that we try to understand how many cases in residents and how many cases in staff and how many of those have been fully vaccinated. So definitely we can see every now and then positive cases. I don't have the exact figure, but I can check with our data team and get back to you. Amy, yeah.
This is Brooke. You'll hear people refer to those as breakthrough cases. That's the terminology that is often used to describe someone who is, it could be anybody, not necessarily happen, because there is no vaccine that is 100% perfect or 100% effective.
All right, looks like, and thank you, Dr. Rosheim. I think definitely a good way to close out the session today. I have a quick poll I'm going to throw up and ask a few folks, hopefully get some input and some feedback, and pull right in. And you get hopefully you got the poll put up on your screen and give us an opportunity. Of course, the chat room's still open for questions while we're doing the poll, but like watching how everybody's coming through. So numbers are looking pretty good. Let it go here for a couple minutes as everybody votes, kind of watch it come in. We got so far we're up to about half of, we're about 50% on the voting. We're getting there. Give it a couple more seconds here, about 30 seconds. Again, Wad, you can still throw in a question into the chat room as we close out the session here. And yes, I'll share the poll with everybody's always wondering, I'm doing the poll. Do I get to see my results? Of course, we'll get to see the results. Yeah, the slides, Jeanette, the slides will be posted on the public website. I'm combining them together and handing them off to Leanne, who's going to help us get that. So hopefully we can come in. So, all right, I think we're at a pretty good spot where the poll numbers are down. That's a pretty good quorum. So I'm going to make sure I'm going to share the results so everybody get to see. And hopefully you get an opportunity to, and again, that's good feedback. Hopefully, Dr. Rosheim, give me a thumbs up. You see the poll, right? All right. So, and I tell you what, this is, I do this stuff quite often, and this is a pretty good feedback session for everybody to get. I know that this is a lot of information we're trying to push through and get everybody working from the same sheet of music. It definitely a little bit of challenge. For myself at VDSS and the Department of Licensing, I definitely appreciative of our VDH partners and how we work together to in these series. And definitely I appreciate the attendees. This is the most important part, is that you're able to attend and get the information and put the word out. And the same as providing feedback. The questions you have are very important to us. There will, like I said, the recording is being made and it'll be available soon as we can get it loaded up. It's kind of a Zoom process that we go through. And there'll be more information on episode 4 as we come up. And until then, everyone, be safe. Thank you for what you're doing and the hard work that you do. And it definitely is appreciated and the results going forward. So everyone have a great day. Enjoyed the lunchtime session and see you soon. And I'm going to give Dr. Rosheim a chance to do a closeout comment.
I just want to thank everyone for attending. I want to thank you for the great questions. If you have any questions now, please, I still want to give people an opportunity. If you have anything else that you'd like to ask, please put it in the chat. We really appreciate the feedback. So one thing that we're going, when Leanne sends out the follow-up email that will have the link to the recording and the slides, we're also going to ask another question about what other areas would you like to hear about regarding COVID-19. We have one 4th session that will be coming up in June. but we would very much like your input. So you know, you can kind of think about this over the next few days. What things would you like to hear about regarding COVID-19 that you haven't heard about so far? Or what things would you like an update on? There's a lot of information, obviously, that's out there. Information is changing. So we want to be here to respond to your input. So just wanted to throw that out there. And thank you again for your attendance and interest.
Okay, thanks everyone for their time today. Again, we're not going to close out the session, so if you've got some questions you want to come in, I'll definitely be by and try to get what I can capture. If we can't answer them immediately, we can definitely capture the question and get out back to you on an email. So I want to thank everybody for your time today, and look forward to seeing you next time.